bringing you the latest health coverage and medical news. Here's Karen McKay's Healthwise at 5.
The first prescription for any patient with acid reflux, also known as gastrointestinal reflux disease, or GERD for short, is a lifestyle change that can include what you eat and how you sleep, and it may also include prescription medications. But if all that doesn't work and you're frustrated, there are other options. And Dr. Douglas Cummins, a surgeon, is here to explain a procedure that has been very successful for many patients, over 100, he tells me, with relentless acid reflux. And you're in Plainview, of course, at the Covenant there.
Yes.
Dr. Cummins, tell us, what is it about acid reflux that for some people, they just can't fix it on their own?
Gastroesophageal reflux is a condition where the stomach juices, including acid, regurgitate from the stomach back into the esophagus. And medication is good at reducing stomach acid, but it doesn't change the anatomy that causes the reflux to begin with.
All right, so tell us about this. It's called the TIF procedure. Tell us what that is and how it works.
TIF is a transoral incisionless fundoplication, and it's a procedure that's done through the mouth inside the stomach, and surgically we correct the anatomy so that we restore the natural anti-reflux barrier in the stomach.
Is that painful when you say correct the anatomy? It sounds like there's some cutting going on, but you said it's minimally invasive.
It's minimally invasive, and I can't tell you it's painless, but it's well tolerated.
So what's the recovery period and the success rate that you've had with your patients so far?
Recovery period for the TIF procedure is pretty quick. A person who can get back to a desk job within 3 to 5 days after surgery, although there are some diet restrictions during the recovery.
For just during the recovery, and then they can get back to eating their normal things that they enjoy?
The goal is that they can get back to eating a normal diet, yes.
So what kind of response have you had from patients? You told me that you've done around 100 people already?
We've taken care of over 100 people, and the success rate is between 80 to 90% of people whose heartburn or reflux symptoms are controlled and they're off of daily medication.
I think people like me who don't have this problem don't realize how annoying it is to people who do. So tell us how devastating it can be to somebody with severe acid reflux and the difference that they have after this procedure.
The people who have daily heartburn and daily reflux suffer tremendously, and it's painful, it's uncomfortable. I hear stories, plenty of patients who can't sleep at night because they have regurgitation when they lay down flat. And the response in the right patient who achieves a good response is just remarkable. A lot of times they've told me it's life-changing.
All right. Well, again, we appreciate your coming in and presenting this option to people who may not be aware this is available. It just means a 30-minute drive to Plainview, right?
That's right.
That's where you do this. Dr. Doug Cummins, a general surgeon in Plainview, who's offering the TIF procedure for those with acid reflux. It's relentless. Thank you so much for being with us to explain this.
You're welcome.